Hello, I'm Dr. Stephen Blomerth. Welcome to Natural Health Today. This is a show that's dedicated to your questions, your concerns, things that may be going on with yourself or your family. And what we do is we invite you to participate in the show by sending in your questions. And you can send in your questions three ways. You can send an email to pbdchiropractic@gmail.com. Or you can telephone my office at 978-535-6155. You can even send an old-fashioned handwritten snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts, 01960. But whichever way you decide to participate in the show, what we'll do is we'll slightly disguise your name so your friends, neighbors, and loved ones won't necessarily know it's you who's asking the question. And we'll talk about ways that we can help you by natural means. I've been in practice for 38 years, and I found that probably 80 to as much as 90% of common everyday healthcare problems that people have don't require drugs, don't require surgery, but can actually be better handled via natural health. And this is how I define natural health. I think of it as four basic avenues. The four basic avenues that I think of are manipulation of joints that are stuck. Because sometimes when a joint is stuck, it can give all kinds of symptoms, not necessarily just at the area where it's stuck. For instance, if you have a stuck bone in your neck, you think, well, it just hurts here. Could hurt in your shoulder, could hurt down in your arm. And freeing that up does a world of good for not only pain, but all kinds of pluses in terms of the energy that you have and your ability to just function normally. The second avenue that I think of is muscles. When muscles have knots in them or trigger points, they may hurt right at the area. Say you might have a trigger point, say here in your shoulder area. Well, that could give you a headache on that side, or it could give you pain down into your chest area too. So muscles have far-reaching effects as well, and there are sheets of muscles and the outer covering of them that run from your feet all the way up to your neck. And a knot or a stuck area in any one of those muscle coverings can have far-ranging effects, much as a joint or a bone that doesn't move. So muscle work via what we call myofascial release or trigger point work can have amazing effects on people's health. The third way that I think of as natural health is via exercise. And I'm not talking about necessarily the type of exercises that you get at a gym, because in all these years of practice, I found that many times the exercises that people do at the gym unfortunately just make stronger the muscles that they use too much already in day-to-day life. So the exercise that I try to promote with my patients and myself are called foundation training exercises, which don't use any weights, don't use any machines. Most of them are done standing, but they help the stabilization muscles that give us better posture and allow us to face many day-to-day tasks. Probably the worst task that most of us face is sitting. Prolonged sitting has a great strain on the body, and it's sometimes unrecognized that sitting is so wearing and so taxing on the body, but it is. It's twice the compression on the spine sitting than there is standing. And the foundation training exercises, best exercise I've found for being stable, having good posture, and staying healthy. And the last but not the least, and these four avenues that I've talked about, I'm not putting them in a certain rank. They're all equally important. They just would enter into a different person's life at a different phase, depending upon what their need was. But the fourth aspect of natural health care that I think of is nutrition, which to me is a lot more than just eating with the four different food groups or the food pyramid that the federal government puts out, which is woefully inadequate. I think of nutrition as not only supplements that you might take, but just your day-to-day eating, because many people will have a bad diet and they think that they can make up for it by taking a vitamin pill. For the most part, that's not true. Supplement should be, just as its name suggests, a supplement to a good diet. So when you put those four avenues together, you can have very powerful effects on getting people better. So I'm going to put on my reading glasses and talk about some of the questions that have come in since our last episode. And our first question comes from Carol. Carol writes in from West Peabody. She says, 2 weeks ago I got this terrible pain in my left thigh. It was so bad that I could barely walk. I didn't fall or do anything different. I hadn't seen my chiropractor for a few months. But I told her about my pain because it hurt so bad. She asked me what exercises I've been doing, and I said just the exercises the physical therapist gave me a year ago. In these exercises, I lay on my back, I hold my leg straight up in the air, and then I move it out to the side, and then I bring it back straight up in the air. My chiropractor seemed to think that was what gave me my pain, but it never hurt when I did it at the time. But now when I try to do that exercise, it kills me. How can we tell if an exercise that doesn't hurt when you do it is the cause of our pain? That is a good question. One of the ways that I try to judge any exercise that a person may do is, does it mimic things that we do in life? Most of the things that we want to do in life are standing. Most of our day-to-day tasks are standing, so to make us stable when we do day-to-day exercises, our exercises to remain stable should be closely, pretty close to doing something standing. Exercises where you're laying on your back, they're okay depending upon how healthy you are at the time. For instance, if this person was a stroke victim, an exercise laying on your back would be totally appropriate, because a person who's been a victim of stroke, perhaps that's all they can do. So if you've been very ill, say if you've had an amputation or a stroke or are bedridden, exercises where you're laying on your back or your stomach are probably okay, because you can't do much more than that. So just any type of movement is going to be of some benefit. But let's say you're a normal, healthy adult, and you've been able to walk. You're not bedridden. You haven't had a stroke. You haven't had an amputation. Perhaps you've had some pain. Your exercise should not be on a machine, should not be laying down, because when you're standing, the exercises that you do, say if I was to move this arm here, if I'm standing and I move this arm here, the opposite side of my body, my legs, have to stabilize myself, because there's an old adage in physics called, for every action there's an opposite and equal reaction. So if I do this with my arm on one side, I have to have a muscle reaction on the opposite side and on the opposite end of my body to help stabilize myself. So exercises done standing are wise because they call for integration. In other words, coordination of the different muscle groups from the right to the left, from the front to the back. When you're laying on your back, and this woman, Carol, was given some exercises to do laying on her back, I'm wondering, what was the idea behind doing it? In other words, it's hard for me to mimic in my chair right now, laying on your back, but you're laying on your back and you have your leg up in the air and you're going out to the side and coming back. What is the sense of that? What is that doing? One of the things that I can think of it would be doing would be pulling on the groin muscles and laying on your back, putting your leg out to the side. That's how people get a dislocated hip. That puts a strain on the neck of the hip. The hip joint, for those who may not know, is a ball that fits inside a socket, and then your thigh bone goes down like that. And so if you pull it out to the side like that and let it hang, you're putting a tremendous force in a direction that your leg doesn't normally have to reinforce. Ordinarily, we're standing or weight bearing, so our hip fits into our socket and is assisted by the weight of gravity of our weight from above securing it below. When you're on your back, you have the weight of your leg not necessarily holding it firmly in the socket, and when we put our leg out to the side like this, when we externally rotate our leg, which is, say if this is my foot, turning it outwards, if I turn my foot outwards, that makes the ball of the hip joint sit less firmly in the socket. So the whole idea of that exercise, I can't think of a single good reason to do that exercise. It didn't hurt when she did it. She did it for a year. But after a year of doing it, she came down with terrible pain. Is it a coincidence? Perhaps. Or was it an unnatural exercise for no good reason, to not accomplish anything, and counterproductive to integration that we need? Again, without examining Carol, it's hard to know. But think about these types of things when you undertake any exercise program. The fact that now Carol gets tremendous pain when she tries to do that, is that a coincidence or just a consequence of having done something over and over again, like water dripping on a stone, that wasn't particularly helpful and that was potentially harmful and resulted in her pain? Carol, I wish I had a better answer for you. Sometimes I do, sometimes I don't. But I hope that'll provoke all our watchers to think about the exercises that you're doing. What are they trying to accomplish? Are they done in the standing position? Are they integrating both sides of the body? If so, great. If they're not, they may not be the appropriate for you. Let's move on to our next question. Okay, Joe writes in from Middleton. He says, I have sore feet that bother me most at the end of the day. It's funny because they also hurt first thing in the morning until I get up and start moving around. But they also hurt me if I'm just sitting still for a few hours after watching TV, because when I get up and start to walk after sitting down, they hurt again. My regular doc arranged for me to see an orthopod, and he gave me some cortisone shots in my feet and a boot to wear on the worst side and a bunch of special stretches to do. But now my feet hurt even more now that the shot is worn off. The doc said my condition is called plantar something or other. Plantar something or other. Do you have any way to help this get better, because it's taking way too long? Okay, the word isn't plantar, it's plantar, and it's just a fancy way of saying the bottom of your foot. For instance, our hand. This surface of our hand is called the palmar section of our hand. The bottom of our foot is kind of an analogy to that. The bottom of your foot is called the plantar surface. And the fancy name for what Joe has, I believe, is called plantar fasciitis. What is it? It's an overstretching of the ligaments that tie the bones together in our foot. Again, I can't show you my foot too well, but I can use my hand. If you can see my hand right now, there's a sort of an arch that's formed by my hand, and there's supposed to be an arch in your foot. If you can imagine a rubber band or ligaments running from here, this point in my hand, to this point in my hand, they have a certain length when my hand is in this position. Imagine if I flatten out that arch. I don't know if you can tell that now the distance between here and here is considerably longer. So any ligament or any elastic material that would be in there would be stretched between this position here, which might be normal, and this longer position. That longer position is what people have when they have a flat foot. When you have a flat foot, you have an overstretching of the ligaments in that area. Why do you have it? You have it because you basically have a flat foot. In other words, a flat foot looks like this. Why doesn't it cause pain from the very beginning? And how does your foot fall? How do you go from this position to this? Well, the thing is, people who have a flat foot never had an arch. People's arches don't fall. My own mother used to tell me, oh, my arches fell when I worked in such and such, and I had to stand on a concrete floor for hours. That's when my mother first had some symptoms in her foot. She didn't know that. That was her story. And for most of us, when we start having pain, we think, oh, that's when the incident happened. But when it comes to having flat feet, we either form an arch about the time that we start walking, or we don't. So that's about at the age of 2 years old when we start walking. We either have an arch or we don't. Some people, majority of people do. Some people don't. People don't have symptoms necessarily at the age of 2. Some people might, but it's pretty rare. The symptoms come much later in life, and many a person has said, well, how come it's bothering me now? I'm 50 years old. It didn't bother me when I was 40 or 30 or 20 or 10. I said, well, you were lucky. You got many years of service out of that foot, that no arch situation in your foot. You got many years of pain-free living before it had a problem. Well, how come it feels painful now? I said, because it's finally become very worn. So when a person gets a shot of cortisone in that area, which is a standard medical practice, what does that do to bring the arch back? Nothing. When they're giving stretching exercises, what does that do? Nothing. Oh, well, let me take that back. It does, it does a little bit of something, but it also is hurtful to the situation. The little good that it does is if you somehow manage to stretch your calf muscle, because just about everybody who has a flat foot has an overly tight calf, so that's okay. But if this area is lengthened and it's gone from this to this at some point in your life, and this is overstretched, will stretching something that's already overstretched make it feel better? No, it won't correct the situation. What you want to do is put an arch back in there by taking an impression of the person's foot and making it so that person's foot, when they have the special insole called an orthotic, their arch is restored. Will it be restored forever? Well, it'll be restored forever as long as they wear that, and if they wear that inside their shoe for most of the day, it'll do them a lot of good. As soon as they take the shoe off, yes, it'll go back to being like this. But stretching that area that's already been overstretched is counterproductive. That's why people take a long, long, long time to get better. Even under the best of circumstances, plantar fasciitis takes a long time to get better. It's just the nature of the beast. Why? Because we're walking on it. So, Joe, you're not going to be helped by getting shots of cortisone. You're not going to be helped by wearing a boot. You're not going to be helped by doing the wrong stretches. You need the right type of care. You need to have an orthotic made from impression of your foot, and you need to stretch that calf muscle without stretching the bottom of your foot. That's not easy, but people who know how to do the exercise that I give them right get better. People who don't, they keep on getting shots and they keep on getting worse. So thanks for that question, Joe. Okay, our next question. Okay, Linda writes in from Danvers. She says, what's the best brand of running shoes to wear, and what do you think of barefoot running? It sounds more natural to run without shoes like people did years ago. Well, you know, Linda is talking about there is a thought that some people have that our ancestors that lived on the wide open plains and savannas of Africa years ago used to hunt game, and that's the advantage that humans have over almost any other animals. We can't run as fast, but we can run longer, and that's how our ancestors got the upper hand when they were hunting. They could run after game, even though they weren't fast. They could keep up a long, long time. So our ancestors ran without footgear on. So why shouldn't we? Well, We could, but we are not running on grass anymore. We're not running on savanna anymore. We are in a situation where we're running on hard concrete and pavement. So our feet won't stand it for too long. If you don't believe me, go out and try it. I really don't recommend it at all. I recommend a running shoe that has 4 aspects to it. You want to hold the shoe in your hand. I'm even going to take off my own shoe right now to show you. All right, this is not a running shoe, but this is the parts of the shoe that you want to be aware of. This part of the shoe is called the heel counter. The heel counter should be firm. I shouldn't be able to compress it, so if I can't squish it in, it's good. I shouldn't be able to wiggle this part of it back and forth. If it doesn't move, that's also good because that holds our heel in place. And that's particularly important. The more flat-footed that you are, you want something to hold the heel, because if you do have a nice orthotic to prop up the arch of your foot, if you prop up the arch, which would occur here, if you don't hold this part of the foot steady, whatever you gain by pushing up here is lost by this fishtailing out. So you want firmness here. This part of the foot, this is on the shoe, this is where we toe off. We want flexibility in this area of the shoe. This part of the shoe is called the shank, this middle section. That should not bend. If that doesn't bend, we're not going to have the increased stress of stretch in our plantar area of our foot that some people, but again, particularly people who have flat foot, that's where they get their main stress and stretch to their plantar fascia. So what brand? I don't recommend any one particular brand over another. I recommend check out what you're buying. Make sure that you can't compress it here. Make sure you can't wobble it back and forth. Make sure that you can bend it here. Make sure it doesn't bend there. Other than that, the color, the brand name doesn't make any difference. Do I recommend barefoot running? I don't. But it has a great ring of theory. In practice, I don't think it's going to be practical, and it probably will bother you. Thanks for the question. Our next question comes from Dave. Dave writes in from Danversport. I had carpal tunnel surgery 2 months ago, and the surgeon says it'll probably take another couple of months before I feel better. I thought they were supposed to take the pressure off the nerves when they cut my wrist ligaments. Well, see, that's the theory. It's a great theory. I don't have the ability to illustrate what a wrist looks like, but I can make a little model. If you can see, there's a little U shape between my thumb and my first finger. That is what the tunnel looks like that allows the nerves, the blood vessels, and the tendons to go from my arm down into my wrist. So in other words, if we thought of this area right here, if we could see inside, if we saw a side view of it, it would have kind of this U shape to it. Now, people will develop problems in that area from overuse, from doing different things. And what the real problem is this area gets flattened out. So if I flatten it out, there's less room. If I make this more, in other words, rather than being a deep U like this, a deep tunnel like this, if I make this tunnel more open like that, if I make it flatter, there's less room for all the contents to fill in. So most surgeons make the mistake. They say, well, I'll cut the ligaments that run between here and here and free everything up. When you cut the ligaments, what happens is it opens up, it spreads apart. When it opens up and spreads apart, there's actually less room in the area. What should be done is something to hold the wrist from the outside like this and hold it together, because all the use that we have bending our wrist in different positions like this puts a strain on this area. We're better off holding these two bones, the bone on the thumb side is called the radius. The bone on your little finger side is called the ulna. If you had a little device, and they're out there, but they're not marketed to too many people. If you had something to hold those two bones together, you'd be better off than cutting that. Some people do need to have carpal tunnel surgery. The amount of people that are successfully treated by carpal tunnel surgery is about 10%. So that means 90% don't require surgery and will be injured and have to have more and more treatment and therapy as time goes along if they do receive that cut in that area. I recommend it for only those people who are actually starting to lose grip strength into their hand. When that happens, the nerves that are going to the muscles in the hands are starting to die, and it does make some sense to have that release just for the people who are on that extreme edge. For other people who just have symptoms but not actual weakness into the hand, they're going to be better off with physical therapy type treatment to break up the scar tissue that's formed in this area from overuse and from better support, not going around the whole thing, just holding the outside together like that. That's a better treatment. Okay, last question is from Sharon. Sharon writes in, she says, I signed up for spin classes because I'd like to lose 15 pounds before my class reunion in June. How long do you think it'll realistically take before I can shop for a new dress? Well, you know what? We've just run out of time. So Sharon, we'll have to talk about that next time. How long will it take to lose 15 pounds in order to make your class reunion in June? I guess we'll have to talk about it in the next show, but it is a great question. So what I'd like to say now is you've been watching Natural Health Today. I'm your host, Dr. Stephen Blomerth, and I invite you to participate in this show by sending in your questions to bbdchiropractic@gmail.com, telephoning my office at 978-535-6155, or sending me an old-fashioned snail mail handwritten letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts, 01960. Whichever way you choose to participate in the show, we'll disguise your name a little bit, but we'll also talk about natural health ways that you can help yourself, because everyday common household problems that we have don't require drugs, don't require surgery, but will respond very nicely to natural health care. So let's talk about that more next time on Natural Health. I'll talk to you later. Bye-bye.